I'm a little discouraged right now because I'm trying to go through the Health and Family Services budget, and I'm just floored at how much money we spend for just covering a wide array of people's needs. I mean, as I covered last time, the whole budget is $7.7 billion. I mean, just some of the big whoppers. I mean, aside from Medicaid, which we already talked about Medicaid, which is almost $5.5 billion itself. But I mean, you've got community mental health centers, you've got millions of dollars for local developmental and intellectual disabilities, got $30 million for something called general support, $282 million for residential services for people with developmental and intellectual disabilities, women's health $13.7 million, maternal health $250 million. What does Medicaid cover? We're paying millions of dollars for resource centers and volunteerism, almost $4 million. Income support, $107 million. $50 million of that is just to determine if somebody's eligible for all these goodies. Community-based services, as opposed to community mental health or community behavioral health, $986 million, almost $1 billion for family support, that's mainly food stamps, $329 million, and TAMF, $41 million for something called medical assistance. Energy, we pay $26 million, child care, $166 million, family and community services, $457 million, child abuse, $6 million, aging and independent living, $65 million. And look, when I go down the street and I see a blind guy or a guy in a wheelchair, I am deeply, I just think, wow, I wouldn't have the guts to do that. And so there is no doubt that I am perfectly happy to spend some of my money to help someone else. And I certainly do not want to turn back the clock and put these people back in basically prisons, psychiatric prisons. But I have to ask two questions. One, in terms of poverty support, do these programs really work? I mean, are they keeping people out of poverty? Are they getting people out of poverty? I don't think they are. And two, is this American? I mean, do these programs encourage our values of self-reliance, self-sufficiency, innovation, and taking care of yourself? And they don't. But I'm not going to do anything about these programs. I'm not going to propose any cuts on them because I don't think our society understands that yet.